Hi guys, welcome back. In this video we shall be talking about test of ovulation. Very simple words. What we want to mean is that we want to say when are you supposed to have sex in order to have your kids, right? So it's very important that we know when is the right time. When are you supposed to do it in order to have the maximum chance of having a baby, right? See, when a women's cycle has been divided, when is women is having a menstrual cycle. Now, the most important thing you have to find out is the patient is having, or the woman is having a regular cycle or not. Let's say the cycle is around 28 weeks. Generally, most of the time, cycle is around 28 weeks, 28 days. Sorry, plus minus 1 or 2 days, right? But the cycle can range from 21 to 35. Mind you, if my cycle is 21 and next month it becomes 25 or next month it becomes 30, yet it is under the normal range, but my cycle is not regular. This is not normal. But if I'm having 21 again next week, next month 21, again next month 21 day cycle, again next month 21, it's still considered as normal. Same case again, if it's 35, 35, 35, 35, it is regular, it is normal. If it is 36, 37, 38, 39, 40, all these things more than 35, abnormal, less than 21, abnormal. And how long should you bleed? You should bleed, the normal range is around from 2 days to 7 days, around 2 to 7 days. And you should be having certain amount of pain when you are bleeding, certain amount of pain. This pain should not be significant amount so that it disturbs your daily activities. You're not able to concentrate in your work, you have to take a leave, you're not able to go to your school, you're not able to go to your work, or you're not able to sleep. That is significant. But yes, you're going to have pain because the uterus is contracting and it is trying to throw out the blood outside. That is normal. But significant amount of pain that is not allowing you to do your daily activities, definitely go and get it checked it out. Along with this, you have to make sure that you do not pass clot of blood. The blood should come out in a liquid fashion. It should not have a lot of clots in it. If you're having clots, it is also a red sign. Okay, so let's say my cycle is 28 days. 28 days cycle. When whatever is the cycle, if the cycle is regular, just subtract from that date minus 14. Right? If you minus 28 minus 14 is coming on 14. Right? If you do, if my cycle is 30 days and if I subtract 30 minus 14, remember this 14 is constant. So whenever you subtract 30 minus 14, that day will give you the ovulation date, right? So what is happening in ovulation? Remember, just basic understanding that every month your body is preparing to get fertilized, right? And whenever the fertilization is taking place, a lot of changes taking place in your body. Every cycle, like you are going to bleed for 2 to 7 days, and then around 14 days you are going to ovulate. Now if you are going to have sex on the 14th day, highest amount of chance that you are going to get pregnant. This is very important. Whenever you're planning for pregnancy, you have to be very careful. You have to be taking folic acid before, prior getting pregnancy. You have to go and meet your gynecologist. You have to take the advice of them. What are you planning? What are your some genetic disorders your family members are having from maternal side and paternal side? What are you guys planning? What is your age? Any problem you guys have? What is the counseling? This is very important, because if you do not know how to do and when to do, you'll be frustrated, right? It's difficult to apprehend that people do not know how to do intercourse. Yes, it is very uh, difficult to understand, but when you sit in the OPD, you can see a lot of patients who do not know how to do it, and they mess it up, and it's not a enjoyable process. So this is very important in order to when you plan to have a baby. Let's say my cycle is 28 days of cycle, so once I subtract 14, so it'll go in 14th day of my cycle. So if I'm having intercourse on 14th day, I'm having a maximum chance of having ovulation. So when I say myself, I'm not going to have myself ovulation, I'm just giving for an example. So the female partner should make a note that on a 14th day of a cycle, she's going to have ovulation. That is very important. Now if you're having this contact is there on 14th day, highest chance that you will be getting pregnant. Remember, the ovum that can survive can survive up to 2 days, whereas the sperm can survive up to 3 days. Let's say if I'm ovulating on 14th day, if I have intercourse on 13th day, yes, the sperm can survive 1 to 3 days, right? And if I have if I have a sexual intercourse on 15th day, yet I can have fertilization, because the ovum can survive up to 2 days and a sperm can survive up to 3 days. So you do the math, right? But the best time is actually your 14 day. So if I practice this cycle once and I don't get fertilized, I don't get, my UPT comes negative, I'm not pregnant, don't be sad. You have to do minimum 3 cycles of this. Then and only we will do further evaluation. We will check if you are having right type of intercourse, your partner is perfectly fine, if there is no erectile dysfunction, the semen is having adequate amount of sperm, the motility is perfect, the sperms are healthy, what is the age factor, are your tubes blocked, a lot of factors will come into action. Because one of the very important thing is that whenever we're thinking about infertile issues, the very important is that we check out the partner in the first place. Because you might be doing a lot of tests in the female, from tubal patency to surgery to follicular stimulating hormones, to many things if we give, but later you find out the partner itself is in fault. It's a lot of pain and unnecessary havoc that the patient has to go. So please check the partner in the first step. Now, why am I telling you this is that you should know when is ovulation taking place. Very, very important. If your cycle is on 28 days, subtract 14, go in 14. But there are some other additional signs, very important. Look, so whenever you're having ovulation, no, you at that time you will be having a little bit of a rise in body temperature. People who are aware, women who are aware of their body very well, they can actually know that their body temperature is high. They actually can know it, their body temperature is high at that time. And also one more thing is that whenever there is ovulation, right, there is literally like an explosion taking place in the ovary. That means the fallopian tube is here and the ovary is here, the ovary. So the ovary literally explodes the egg, and the fallopian tube, it actually catches. So it's literally like an explosion taking place. So it is painful. So whenever there is explosion, there is a little bit of blood. So this blood slowly trickles down into the deepest structure of the women body, that is your pouch of Douglas, and it goes and irritates the patient. So the patient will be complaining of irritation of pouch irritation. So the patient will complain, I'm having abdominal pain, maybe on the right side or the left side, because one side of the ovary is working in one cycle, right? Either on the left side or either on the right side. Okay, this very, very important. But this pain is not always present. Many people might not be able to know it. On around 14 days, on the mid-cycle pain, there can be pain. The patient can say, early in the morning when I wake up, I can feel a little bit of uneasiness on my right side. It's paining, and the pain goes out around, let's say, 1 o'clock, 2 o'clock, or 12 afternoon. It goes out. So that is very important, that you should know that yes, there is ovulation. Another one is, I told you, is your temperature. Your temperature, you'll feel your temperature is high, and very, very important is that whenever there is high amount of estrogen, remember. So whenever there is ovulation, what is ovulation in the first place? Before the ovum to come out from the ovary, what is happening is that your body is producing certain amount of estrogen, and this estrogen is produced, it gets into a certain level. Once it hits that level, it's going to give a signal to your brain to release another hormone, is LH. Now this hormone is just exactly like an digestive enzyme. Very easily, I'll tell you. This digestive enzyme will come and will act onto the your how do I explain? Okay, it will come and act onto your egg. The ovum is covered by tough layer. It's a protein layer is covered over the ovum, right? It will come and it will cause proteolytic enzymes. Just simple. It is made up of protein. You break the protein, eat up the protein. The oocyte, the egg which is inside, will come out of the structure, right? This is due to LH hormone. Once the LH hormone is out, the rest remaining follicles will turn into corpus luteum and will produce progesterone, right? So whenever you see around 14 days, whenever around 12, 13, 14 days, if you see your cervical mucus will be very, very elastic, will be soft and very elastic. Like, so if you introduce a finger into your vagina, onto your cervical mucus, if you pull it out, you can see the strand coming and it will be stretching to a very great extent, then it will get tear apart. So on 14 day, it is very, very, very significant, very long. But on around 15, 16, 17 days, it will become thick. It will not be having the stretchability component will go out. Along with this, when you do and some other lab test, if you see your serum progesterone level, the progesterone level will be high. The ovulation is taken to the level will be high. If you do your LH level will also be high. So these are the clinical tests you do. LH and your progesterone level will show high level because the ovulation has taken place. But on the patient's level is very important. If you see your cervical mucus will be very sticky, very sticky and very watery. It will be very watery, and it will be very not sticky, very watery, and it will be very having a lot of stretchability will be there in your cervical mucus. Once the ovulation takes place, it will become very thick, and the stretchability will be gone, right? This is very important factor. And your temperature, it's very very important. And your mid-cycle pain is relatively important. Not every patient can tell that they're having mid-cycle pain. And please make sure whenever you're having your cycle, please maintain a calendar. Please maintain a calendar. Okay, this date my period has started, so it's going to stay for like 2 3 4 5 days, whatever it is going to stay. Once the period is done, again the new cycle begins. You understand? When what is happening because of estrogen, a lot of endometrial lining in your uterus are being formed due to estrogen. Now this thing is formed. Now after it will become ripe, it will become filled with fluids, blood vessel will come. This is done by progesterone. Okay, the word itself says progestation hormone, the hormone that is going to continue the pregnancy, right? That is very important. So uh, and one more thing that I want to share is that pain, you are experiencing pain during cycle. If you're experiencing pain during cycle, it means it's an ovulatory cycle. That means you are ovulating, and you should change your perspective about thinking about the pain that you suffer when you are having bleeding phase. There are many women in the world who are hoping that they get this pain because they're infertile, they're not ovulating. So change your perspective that yes, I'm ovulating because I'm fertile, my organs are working perfectly fine. So if you see in this manner, I hope the amount of pain that you suffer is going to reduce to a drastic amount. Yes, of course it's painful. I've seen a lot of my seniors, my classmates, my juniors are having pain. A lot of my patients, and everyone is having, when I sit in the OPD, I see so many patients having so much of pain. It's painful. There's no doubt in it. But if you change your perspective into it, it definitely will be happy that yes, this pain is actually helping me and make sure that I am perfectly fine and I'm ovulating. So it will help you to reduce the amount of pain, reduce the change the perspective about pain related to menstrual cycle. So very important. Again, summarize. Remember the temperature and remember the cervical mucus stretchability and your temperature and mid-cycle pain. That if you, and 14 days is very very important. 14 day of the cycle is going to be very important in order to have sexual intercourse and have a baby. And best of luck. Thank you.